everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. Many thanks to all our new subscribers. This is a channel where we educate ourselves on common health problems. So if you're new to this channel, I would really appreciate if you hit on the subscribe button and also on the notification bell so you don't miss anything that I upload. Today, I'm going to be spending some time with you talking about hemorrhoids. We are going to be looking at some causes of hemorrhoids and some things that you can do to prevent and treat hemorrhoids. Hemorrhoids are also known as piles, and they are swollen veins that are found inside or around the rectum and anus. They look similar to varicose veins. They exist in two forms. We've got the external piles and the internal piles, and these two can develop at the same time. The external piles develop outside the anal passage in an area just below the anal sphincter. The anal sphincter is a band of muscle at the exit of the bowel that helps retain the feces until ready to go to the toilet. And internal piles develop inside the anal passage in the rectum. They develop in the lower part of the large bowel above the anal sphincter. In some cases, internal piles can become so swollen that they protrude from the anus. Piles are extremely common, and nearly half of the population will develop piles at some point during their lives. All age groups are affected, but piles tend to first appear in the mid-teens and become progressively more common as one gets older. In many cases, piles do not cause symptoms, and some people don't even realize they have them. When symptoms occur, they do vary from person to person, and they are dependent on whether the piles is internal or external. Symptoms may include bleeding after passing a stool, and the blood is usually bright red. You may see blood on the toilet paper or drips in the toilet or on the surface of your stool. There may also be a lump hanging down outside of the anus, which may need to be pushed back in after passing a stool. Large piles can prevent the anal sphincter from closing properly, and as a result, feces may escape to soil underwear. The escape of feces may also lead to intense itching of the area around the anus. Also, there can be a mucus discharge after passing a stool, which may stain your underwear. Soreness, redness, and swelling around your anus can also occur. When blood supply to the anus slows down or is interrupted, then pain and discomfort occurs after you go to the toilet. It is important to note here that these symptoms may also be caused by problems other than piles, and examples of such problems are inflammatory bowel disease, anal cancer, bowel cancer, and anal fissure. So if you have any of these symptoms that I have just described, then contact your doctor or your pharmacist for advice. Don't just assume they are caused by piles. So what causes piles? Piles may occur due to a number of reasons. Constipation is the most common cause. Straining when going to the toilet in an attempt to pass large hard stools when you are constipated damages the lining of the anal passage and increases the pressure in the blood vessels supplying the area. The blood vessels then swell under the increased pressure, leading to piles. Also, piles can occur as a result of sitting for long periods of time on the toilet, a long-lasting diarrhea, being overweight or obese. Piles are also common during pregnancy, having anal intercourse, eating a low-fiber diet, and regular heavy lifting. Getting older can also increase your risk of getting piles, and this is because your anal canal weakens with age. Also, a persistent cough can cause piles. So what can you do to prevent hemorrhoids and reduce the symptoms of hemorrhoids. You can follow these simple home remedies. Number 1, eat high fiber foods. That is, eat more fruits, vegetables, and whole grains. Doing so softens the stool and increases its bulk. And this helps you avoid the straining that can cause hemorrhoids. Add fiber to your diet slowly to avoid excessive flatulence. Avoid refined foods, processed foods, and dairy products. Number 2, drink plenty of fluids. Drink 6 to 8 glasses of water and other fluids each day to help keep stools soft. Avoid alcohol and caffeine-containing drinks, such as cola, tea, and coffee. Number 3, don't strain. Straining and holding your breath when trying to pass a stool creates greater pressure in the veins in the lower rectum, and this can also worsen the symptoms. Number 4, go as soon as you feel the urge. If you wait to pass a bowel movement and the urge goes away, your stool could dry out and be harder to pass. Number 5, exercise regularly. Stay active to help prevent constipation and to reduce pressure on the veins. Exercise can also help you lose excess weight that might be contributing to your hemorrhoids. Number 6, avoid long periods of sitting. Sitting too long, particularly on the toilet, can increase the pressure on the veins in the anus. Number 7, to reduce itching and discomfort around the anus, be gentle on the bottom. Use moist toilet paper or baby wipes rather than dry toilet paper to clean your bottom after passing a stool. Pat the area instead of rubbing. Wash your bottom regularly, if possible, after each bowel movement in a bath. The use of warm water helps remove any traces of feces left after wiping that can be a cause of irritation around the anal area and help ease discomfort. Take warm baths, as that helps soothe the perianal area. Number 8, cold compress may also help shrink the hemorrhoid. And number 9, learn to lift weights correctly. Know your limitations and ask someone to help you lift heavy objects that are beyond your limits. Bend your knees, keep a straight back, and contract your stomach muscles when lifting to avoid undue pressure on your anal and rectal areas. And number 10, you can visit your pharmacy and have a word with the pharmacist. Do not be embarrassed to talk to your pharmacist about piles. Piles are a very common problem. Your pharmacist would ask you some questions about your symptoms. And if they are satisfied that you are not suffering from something more serious, then they would recommend a product best suited to the symptoms you have described. You can get creams, ointments, and suppositories, and these are all available without a prescription. They can be used to relieve any swelling and discomfort. Some of the creams and ointments are supplied with a special applicator, allowing them to be squeezed through the anal sphincter, so they can be used to treat both internal and external piles. Suppositories are used for the treatment of internal piles. If you are constipated, then laxatives can help soften the stool. And you can check out my video on constipation, within which I elaborated on the various laxatives available from your local pharmacy. If piles are causing discomfort or irritation, then there are a number of products that would help. And these include soothing agents. These have emollient and protective properties and help prevent local irritation. And examples are zinc oxide and allantoin. We've also got astringents. An astringent is a chemical that shrinks body tissues and reduces bleeding. Astringent preparations for the treatment of piles include substances such as witch hazel and bismuth subgallate. We've also got local anesthetics. These alleviate pain and irritation, and examples are lidocaine and benzocaine. They do cause sensitization of the perianal skin, so it's advisable to use them for only between 3 to 4 days. There's also topical steroids. Topical steroids help reduce pain and inflammation, and an example is hydrocortisone. Topical steroids may thin the skin, and so they should not be used for long periods. It is best to limit use to 7 days only. Common pain-killing medication, such as paracetamol, can help relieve the pain of hemorrhoids. However, if you have excessive bleeding, avoid using non-steroidal anti-inflammatory drugs such as ibuprofen, and this is because it can make rectal bleeding worse. You should also avoid using codeine painkillers because they can cause constipation. Seek medical advice if over-the-counter treatments prove ineffective, or if symptoms persist for more than 2 to 3 weeks. See your doctor if it becomes too uncomfortable to move the bowels, or if rectal bleeding occurs, or if there is any associated abdominal pain or vomiting. Your doctor will examine you to determine whether you have external or internal piles. And depending on their severity, your doctor may prescribe more powerful products than you can purchase from your pharmacy, or a decision may be made to send you to a specialist to have the piles removed. Even though complications of piles are rare, they can still develop and they can be unbearable. So as much as possible, you want to carry out the preventive measures so you do not develop the symptoms. Chronic blood loss from hemorrhoids may cause anemia, in which you don't have enough healthy red blood cells to carry oxygen to your cells. Also, you can develop a strangulated hemorrhoid. If the blood supply to an internal hemorrhoid is cut off, the hemorrhoid may be strangulated, and this can cause extreme pain. Occasionally, a blood clot can form in a hemorrhoid. Although not dangerous, it can be extremely painful and sometimes needs to be lanced and drained. External piles, that is swellings that develop further down your anal canal, closer to your anus, can become inflamed and swollen. Ulcers can form on them. Skin tacks can form when the inside of the pile shrinks back, but the skin remains. If mucus leaks from your anus, it can make the surrounding skin very sore. So today I've spent some time with you talking about piles. We have looked at some causes of piles and some symptoms of piles. We have also looked at some things that you can do to treat and prevent piles, as well as some complications of piles. I hope you have learned something today. If you have, then please give this video a thumbs up. Remember to share this information with family and friends, and please leave your comments, your suggestions, and your questions in the comment section. Please hit on that subscribe button and also on the notification bell if you haven't yet done so. Thank you so much for joining me today, and I hope to see you soon in my next video. Bye for now.